Hey there, everybody, and welcome to today's live webinar. We will be getting started in just a second. Oh, just a second. There we go. Okay. It is a little bit dicey here today. I will be recording this like usual, and I will upload it sooner than usual. So if you just can't take the blurriness, you'll have it in high def, hopefully before the end of the day. But that all depends on when we get our internet. Until then, thank you everybody for being here. I really appreciate all of you for attending and learning about this very important topic. So without further ado, let's get started. I'd like to welcome everybody to today's presentation on tinnitus and mental health, essential knowledge for counselors. When patients complain of ringing in their ears or sensitivity to sounds, it's more than just an annoyance in many cases. It can impact every piece of life. The good news is stress management techniques and cognitive behavioral techniques, as well as a few other things, have been shown to help alleviate some of the distress caused by tinnitus. Today, we're going to define tinnitus. We're also going to talk about misophonia and hyperacusis. Both of these are hearing-related issues that often co-occur with tinnitus and are really important because they also contribute to a lot of functional impairment. We will learn about the prevalence of these issues, examine the causes and common co-occurring issues, because a lot of times people are not going to present in our offices saying, hey, I've got tinnitus, help me. They're going to say, hey, I've got anxiety or depression or insomnia, help me. And this may be one of the things that's causing those symptoms that they're presenting for. So we do want to screen for audiological issues. And then we'll identify practical evidence-based tools to address distress. Now, I think it was last week that was the annual tinnitus awareness celebration or recognition week or whatever. So I missed the boat on that by about a week. But it is something that we are trying to increase awareness of. Tinnitus is the perception of sound in the absence of an external or acoustic source. So we're hearing things in our ears that nobody else hears. I've got tinnitus. My husband has tinnitus. A lot of people have tinnitus. It's pretty common. My best friend has really bad tinnitus. And there are a lot of things that make it worse. There are some things that make it better. But unfortunately, they really don't know what actually causes it. And there's no way currently to actually fix it or make it completely go away. So our job as clinicians is to help people reduce their functional distress in relation to the tinnitus, hyperacusis, or misophonia. Severity and distress in tinnitus vary widely and are not reliably predicted by sound intensity or degree of hearing loss. So for some people, their tinnitus may be deafening, but it doesn't bother them as much as somebody else where it's just this constant background hum. Every person is different, and you don't necessarily have to have hearing loss in order to have tinnitus, although it is more common. Hyperacusis is a decrease in sound tolerance characterized by discomfort from everyday sounds that are normally tolerated by others. Reactions are driven by the loudness of the sound rather than its meaning or its context. There is one background sound they have on a channel that I watch frequently, and oftentimes I end up turning the television off because they use this sound as a filler when they don't have commercials, and it's a very low bass sound. Something about that sound hurts my ears. It's almost like somebody's banging a drum inside my ears. So I understand where they're coming from there. Not everybody gets this. And hyperacusis, tinnitus, and misophonia, they can develop at any point in life. It's not something that somebody's necessarily born with. Misophonia is emotional distress related to specific trigger sounds that are, interestingly enough, often human generated. Now, human generated is kind of broad there. The responses are linked to the meaning and pattern of sounds rather than the loudness, according to the research. There are a lot of sounds, for example, and you're going to learn a lot about me today. There are a lot of sounds, for example, that just grate on my nerves. Now, whether that's hyperacusis or misophonia, I don't know. But like when my dog starts licking his paws after coming in from being outside, I can tolerate it for about 20 seconds. And then I'm like, make it stop. Examples of misophonia. These are sounds that just make people get really tense and stressed out. Chewing, dog licking, breathing, slurping. So if somebody's slurping their drink, gum chewing, pen clicking, finger or foot tapping, vocal fry, keyboard typing. That would really suck if you work on a computer. Plastic crinkling, fan noise, and certain consonants like S, T, and K. Those can be very bothersome for people, and it actually triggers a very strong guttural reaction. It's not just like, whatever. The best I can liken it to for if you don't have misophonia is somebody dragging their fingernails down the blackboard. It is something that makes you go, oh my gosh, make it stop. How prevalent are these? Is this something that we even need to worry about? Yes, it is. 10 to 25% of adults have tinnitus. Now, part of that is because a lot of us as adults also have some degree of hearing loss. But 10 to 25% of adults have tinnitus, and the prevalence is much higher in clinical populations. So people who are coming in for anxiety, trauma, depression, even grief, but anxiety, trauma, and depression in particular are often much more likely to have one or more of these conditions. Severe or disabling tinnitus affects 2 to 3% of adults. Okay, just because it's not severe and disabling doesn't mean it isn't annoying. Sometimes, and we're gonna talk about this, it can be more episodic. Stress actually increases or worsens the misophonia, the tinnitus, and the hyperacusis. So when people are more stressed, they tend to be more reactive to those sounds. They tend to notice the ringing in their ears more. When we're stressed, our brain is in protection mode. So what does that mean? It means sensory gating goes down. When we're stressed, our body lets in more sensory input than it normally does. So we become more aware of the sounds that are around us, whether they're actual sounds like somebody chewing or a dog licking, or they're ringing in our ears. We become more aware of it because our body is less able to gate it out, to block it out for us. Therefore, stress management and downregulation tools, we're going to talk about them, can be super helpful in managing. Also recognizing, for example, when you get stressed or when your client gets stressed, does that make them more susceptible or more easily triggered by sounds if they've got misophonia or hyperacusis? Does that make them more aware of the ringing in their ears? And if so, we can work with that. Helping them recognize the connection can be one strategy for helping them feel more empowered. Even though if you go to an audiologist, they'll say, there's not much we can do to make it go away. We can help you learn how to live in the and. We can help you learn how to have tinnitus and live your rich and meaningful life to the best of your ability. But right now, they don't know how to make it go away. Hyperacusis, being sensitive to sound, more sensitive than other people. So things like a vacuum cleaner may be deafening or painfully loud to people that have hyperacusis. In the general population, 6 to 17% of people have hyperacusis. And it co-occurs with tinnitus about 33% of the time. So you've got 25% of adults who have tinnitus, and about a third of them also have hyperacusis. The more conditions they have, the more auditory distress that they experience, the more likely they're also going to have mood disorders, cognitive distress, and even increased insomnia and systemic inflammation. Misophonia, that not being able to tolerate certain sounds. 15 to 20% of individuals report misophonia-related distress in daily life. Think about how challenging it would be if one of the things that was triggering for you was hearing paper rattling, or hearing somebody type, or hearing somebody's heels. When you walk on concrete in high heels, it makes a certain clicking sound. If that just really triggers you, think about how challenging it would be to exist in a shopping center, in the workplace, etc. In people with tinnitus or hyperacusis, 20 to 25% report clinically significant misophonia symptoms as well. They don't always go together, but there is a subset of people that have all three of these. There is a subset of people that have two of these. And then some people may just have hyperacusis or misophonia and not tinnitus. But screening for these is really important because it falls under the category, if you will, of stressors that we can help people develop tools to manage. In terms of mental health, tinnitus severity is positively associated with symptoms of depression, anxiety, and PTSD across clinical and population studies. So the general population as well as clinical, we see a strong correlation between the symptoms as these hearing issues become worse, the mood symptoms and the trauma symptoms may become worse. Misophonia and hyperacusis are also associated with elevated emotional distress independent of audiological findings. That's so important because a lot of people think that, well, my doctor can't find anything wrong with my ears. My ears are just fine. Therefore, why am I having this? I feel like people are telling me that there's not a reason, and it's, quote, all in my head. It's all in your neurons. And that's true, but it's neurological and it is happening. It's not something people are making up. It's not something people are malingering. Sleep disturbance. Insomnia and sleep disruption are very common in individuals with tinnitus and increase with tinnitus severity and are considered a core component of tinnitus-related impairment. So let's go back to tinnitus and sleeping. A lot of times you're trying to sleep when it's quiet. For people with tinnitus, the silence can actually feel deafening. The humming, the ringing, whatever the sound is in their ears may be a lot louder or that perceived to be a lot louder when there's not something else going on. I go to sleep with the television on. Why? Partly because it helps me focus my attention on a sound over here instead of the ringing in my ears. Okay? People who have tinnitus often have difficulty falling asleep for that reason. Likewise, people with misophonia or hyperacusis, depending on what's causing it, may be hypersensitive or more sensitive than somebody who doesn't have that problem to the sound of fans. My ceiling fan, I can't tolerate it when it's on the low setting. It makes this really low frequency hum that just grates on my nerves. Told you were going to learn a lot about me today. But I can turn it on medium, and it's a different sound, and it's a sound I can tolerate. Finding workarounds can be really helpful for people if, for example, they need the fan on in order to sleep comfortably. But we know that when people are not getting quality sleep, they're going to have an underlying increase in their stress response. An underlying increase in their stress response is likely going to worsen the symptoms of the audiological problems. So we need to help them get good quality sleep. That's one of the first things that we can do, or work with them and work with their sleep specialist to do, to help them eliminate unnecessary causes of distress. Chronic tinnitus and misophonia are associated with heightened stress reactivity and sympathetic nervous system dominance, dysregulation. When people are constantly hearing this ringing, or it feels like everywhere they go, there's people making sounds that are just intolerable, it can feel very unwelcoming. Not necessarily scary, but unwelcoming to leave the house. It's like, if I go out there, I'm going to have to hear all this stuff, and it's really stressful. Don't want to do it. So people may spend a lot more time at home. The fallout from this is the fact that as they become more sympathetic dominant, that means their stress system is going to stay on more of the time. It's going to respond more robustly, which means we're going to have a corresponding possible increase in perception of symptom severity. Stress is both a maintaining factor and exacerbating factor for any of these audiological issues. And it's not just stress about the audiological issues. It's stress about anything. When stress is high, sensory gating goes down, these noises become more prominent, more salient to our awareness. Concentration and attentional difficulties are also linked to emotional and physiological reactivity, sympathetic nervous system activation, rather than necessarily hearing loss. A lot of people with these audiological issues don't have hearing loss, or it's minor. However, they do have these issues, and the stress caused by these sounds or fear of encountering these sounds increases their nervous system activation, their sympathetic dominance, which, what does it do? It shunts blood away from the cognitive functioning, our executive functioning area of the prefrontal cortex, over to the hypothalamus and the amygdala, so we're prepared to fight or flee. It also opens up the floodgates for all the sensory awareness, so we don't get taken unaware by random things sneaking up on us or whatever. But understanding that when that happens, when we are chronically stressed, we're almost always, not always, but almost always probably going to have some level of brain fog, some level of difficulty with sustaining attention to non-survival based things. And this is what we see in people with misophonia, tinnitus, and hyperacusis. Hyperacusis and misophonia frequently co-occur with tinnitus and are associated with greater functional impairment and distress. As I said earlier, dealing with one's bad enough. Dealing with 2 or 3, oh my gosh, it's just piling it on. And they have different issues, being sensitive to how loud a sound is, being more easily triggered or feeling more pain, literally feeling distress at sounds at levels other people aren't bothered by. If you've got little kids, if you've got dogs that bark, you can imagine the different sounds that can be bothersome to people in everyday life and how it may make them feel powerless and hopeless. Pain and bodily discomfort, particularly in individuals with high psychological distress, are very common. Why? Well, when you're stressed all the time, what's going on? Your sympathetic nervous system is up, which we know through a cascade effect leads to increased systemic inflammation, but you're also just tensing those muscles. And when your muscles are tense all the time, you're kind of working out, do those isometric contractions, not even thinking about it. People with these audiological difficulties often have a lot of tightness. They're almost kind of trying to guard their ears, which means they have a lot of tightness in their neck. They're more prone to migraines and headaches. Somatic symptoms are reported across tinnitus, hyperacusis, and misophonia populations and often worsen with stress and mood symptoms. And it's bidirectional. When the mood gets worse, the symptoms get worse. When the symptoms get worse, the mood gets worse. We also see changes in the gut microbiome and the motility of the gut as a result of stress. So people can have gut-related distress when not only are they stressed, but they're also experiencing more symptoms of the issues that they're having. People with diabetes are at greater risk, especially of tinnitus. The longer the duration they've had their diabetes and or the severity of diabetes is associated with an increased risk of tinnitus. Why? Well, one of the risks of diabetes is hearing loss. Why? Because high blood sugar starts causing peripheral neuropathy in the nerves of the ears. Yes, it's not just the fingers, it's not just the toes, it's also the ears. So people with diabetes, especially not well-controlled diabetes, have difficulty hearing sooner and may develop more symptoms of tinnitus that, again, it's stressful. What do we know about stress? It increases our blood sugar. So the person with diabetes is working upstream, helping them recognize that developing tools to feel empowered to manage their tinnitus symptoms is going to help with their blood sugar regulation, can be an effective motivator. Tinnitus is commonly associated with hearing loss, though it may arise without a single identifiable cause, reflecting a multifactorial and heterogeneous mechanism, which people don't like to hear. They want to know, Doc, what made this happen and how do I fix it? And right now, audiologists are going, got me. We know it exists. We know what you're experiencing is real, but we don't know what's causing it. Noise exposure, either occupational or recreational, is a well-established risk factor for tinnitus onset and persistence. My best friend was in the military for 20 years. Lots and lots of bangs and booms. My husband was in law enforcement for 20 years and was on the rifle team when he was in high school. Lots and lots of bangs and booms. I haven't been around a lot of guns, but I've been a fitness instructor for 30 years and I like the music loud. So again, that can contribute to the development of mild to moderate hearing loss in people. Tinnitus is associated with changes in the central auditory processing and neural activity beyond the external ear. It's not necessarily a structural issue. It's actually how the nerves communicate the information they're getting to the brain and how the brain receives it. Non-auditory factors, including stress and emotional distress, are associated with tinnitus severity and persistence. When we are stressed about something, we're going to be more alert to it. If you're worried that a snake is going to come out across the path when you're hiking, you're going to be hypervigilant for snakes. When you are worried or feeling powerless about your tinnitus, you're going to be more hypervigilant to that tinnitus. You're going to be more likely to notice it when it starts happening and pay more attention to it when it does. Misophonia is not caused by hearing loss or abnormal sound detection, but is associated with emotional and physiological responses to specific trigger sounds, irrespective of sound intensity. Now, I know, for me, when I'm stressed, chewing and licking just really grate on my nerves. I can tolerate it a lot. When I'm not stressed, I can tolerate it for a little while. But when I'm really stressed, even sitting at the dinner table with my family while they're eating, I can hear them chewing. I can hear myself chewing, and it bugs me. So during those times, I have to take steps to downregulate my stress response, to turn my attention to something besides the chewing sound. There are tools that can be used, and, if it gets bad enough, I excuse myself from the table and find something that I don't have to chew in order to get my nutrients for that day. But thankfully, it has never gotten that bad. Misophonia involves increased coupling between auditory processing and limbic emotional networks, though causal mechanisms are still under investigation. So you encounter this stimulus, this sound at some point, and for some reason, it just triggers you. Your amygdala remembers that. Your hypothalamus remembers that. Then when you encounter that sound again, your brain goes, oh, we remember this. This is unpleasant. We don't want to hear this. And that's when you start kind of building on that core belief about that sound. Misophonia may occur as a primary condition or alongside other neuropsychiatric or sensory conditions. Hyperacusis is associated with abnormally increased sensitivity to sound intensity rather than sound meaning or pattern. It can be any sound, but when it crosses a certain volume threshold, it becomes very unpleasant for the person. Sometimes it's sounds that are in a certain register, so bass sounds or treble sounds, but things that are in the middle area, not so bothersome. For other people, it's the entire spectrum of sound. Asking your clients, are there particular types of sounds that are more bothersome to you? People with trauma histories may have certain sounds that they associate with that trauma. They may not know it consciously, but subconsciously. Some of the sounds that trigger their misophonia or the hyperacusis may be associated with prior trauma. But ultimately, it's the intensity of the sound for hyperacusis that we need to worry about. If you've got somebody who is, maybe they've got grandkids coming over, and we know kids can be loud. How do they handle that when the grandkids come over so it's not a stressful experience for them? The more stressed they get, the more sensitive they're going to become to sound, and it's going to become challenging. What can they do when the grandkids are there? If the kids start getting loud, they're kids. What can they do in order to downregulate so they don't end up spiraling? Like tinnitus, hyperacusis is considered a heterogeneous condition and has been linked to noise exposure, auditory injury, and neurological factors, although mechanisms vary across individuals. They don't know. Psychological factors such as fear of sound and sound-related anxiety are associated with hyperacusis severity and maintenance, though not the primary cause. Well, it makes sense. If you hear a sound of a certain loudness and it hurts, then you're not going to want to hear that again. So it makes sense that people are going to develop anxiety about hearing those particular sounds. In terms of overlapping features, all of these conditions are characterized by heightened distress that's not reliably explained by sound intensity or audiometric findings alone. It's not all in their head. They're not making it up. We know that there's something going on neurologically with them. However, it's important for us to help them to figure out how can they live their richest, most meaningful life and be sensitive to sounds and have this ringing in their ears. Increased involvement of non-auditory neural networks, particularly those related to emotion, attention, and salience, are also common. Again, we hear it, our body perceives it, but then we interpret it. So then we put a entry, if you will, into the hypothalamus database, and if it's painful enough, the amygdala remembers it too. When we experience that sound in the future, our brain's going to go, yeah, that's unpleasant, and it's going to trigger the stress response. We start to see emotional reactivity. We start to see people become conditioned to people, places, things that have triggered that distress in the past. Sympathetic nervous system activation and emotional reactions play a central role in symptom burden across all of these disorders. Attention and awareness of sounds are increased across conditions, contributing to perceived intrusiveness. When people pay more attention to it, it seems more intrusive. It feels more intrusive to them. Think about if you haven't had any of these issues, think about if you've had back pain. You hurt your back. And when you pay attention to the pain in your back, it feels like it's keeping you from doing everything. It's hurting all the time because you're paying more attention to it. You're more aware of it. If you turn your attention to something else, does it make the pain actually lessen? No, probably not. It makes us less aware of it. It turns our attention to something else. Avoidance behaviors are commonly observed and associated with greater impairment. Going to the grocery store, if that squeaky wheel, because every grocery store has a cart that has that squeaky wheel, and if that squeaky wheel is just painful, or the sound coming when they do an overhead broadcast about something, if that's just too loud, then people may not want to go to that store. They may stop going to stores. They may not want to go to restaurants if they're worried that the noise in the restaurant is going to be overwhelming, or, you can imagine. Bidirectional impacts. Tinnitus and misophonia are associated with heightened sympathetic nervous system activation and dysregulation. We start to see the SNS become very powerful, and the parasympathetic nervous system, the vagus nerve, not able to do its job. It's just not kicking in. We need to help people develop those down-regulation skills so they can acknowledge what's going on in the moment. We're not invalidating it. They can acknowledge what's going on in the moment, and they can trigger the relaxation response so they're not perpetuating the distress. They're not intensifying the distress. Doesn't mean it's not there. What we're saying is, okay, let's take a little bit of the pressure off so then you can figure out what you are empowered to do to manage the situation. Tinnitus severity is strongly associated with insomnia and sleep disturbance, and sleep disruption increases tinnitus-related impairment. Severe sleep apnea has also been associated with tinnitus and vice versa. Now, it's important here. Severe sleep apnea. You can have people with sleep apnea, and they found that people with low to moderate sleep apnea, there's not a correlation with their tinnitus symptoms. But people with severe sleep apnea, and I'm not exactly sure what propels you into the severe category, they weren't clear in the article, but people with severe sleep apnea have sufficiently disrupted sleep that they are increasing their stress and systemically, which is also possibly increasing their symptoms of tinnitus. Likewise, the stress of tinnitus may cause people to have a lot of stress up here in their neck and in their shoulders and in their airway muscles, which can contribute to worsening of sleep apnea. As I mentioned earlier, metabolic conditions, including diabetes, are reported as comorbid conditions in tinnitus populations in particular. Why in particular? My guess, I'm just hypothesizing here, hyperacusis and misophonia are on and off. You can be in an environment where it's quiet and you're not going to be bombarded with overly stimulating or noxious sounds. So you get a break from it. Tinnitus, not so much. Tinnitus for a lot of us is 24/7, 365. It ebbs and flows in how loud we perceive it to be, but it's there. It's constantly there. That constant stressor, that constant annoyance increases the stress response, which makes blood glucose control more difficult. Helping people, again, recognizing that regulating their stress will help with their blood sugar as well as their tinnitus can be very helpful. People with headaches and migraines often have co-occurring audiological issues, one of the three or all three. We do need to ask them about that. If they report that they have chronic headaches or migraines, then we want to start asking about ringing in their ears or sounds seeming or feeling louder to them than they do to other people in the environment. Migraines, if you've got a migraine. That's not something that we've got to really question. But for people who have migraines, some of these issues can trigger an onset of a migraine. Interpersonally and intrapersonally, individuals with tinnitus report lower self-esteem compared to those without tinnitus in proportion to symptom severity. If it's mild tinnitus, yeah, it's annoying, but I feel pretty good about myself. I can do most of the things that I want to do. Not a problem. I have to make some mild adjustments. For people with severe tinnitus, they may not feel like they can do the things that they should do. They may not feel like they're able to be the person they want to be because of the symptoms. Tinnitus-related distress is associated with reduced perceived ability to cope and manage symptoms. Helping people look at facts in this context at this time. How are you coping? How are you managing your symptoms? Encouraging them to keep a log of the severity of their symptoms, of how well they feel they're able to manage the distress or manage the symptoms on a day-by-day basis. And when you see a flare, when it seems like they're having more difficulty managing their symptoms, then we want to look backwards and say, okay, what changed? Did you start sleeping less? Are you under more stress? Maybe they're anticipating that they're going to go on a trip and they're going to have to fly somewhere. Oh my gosh, take these issues, compound that with being on a plane where your ears are popping and you have that constant hiss of the airplane noise. It can be very stressful for somebody. So it could be anticipatory anxiety that is triggering a worsening of symptoms. Cognitive therapy-based interventions address low perceived control in order to help people recognize that addressing this, we may not be able to make it go away, but there are things that they can do to improve their quality of life and give them some sense of subjective relief. Misophonia can strain interpersonal interactions and may reduce tolerance during social interactions. If you're talking to somebody who is smacking their gum and that's one of those sounds that triggers you, or if they're using a lot of S's, and I intentionally tried to soften that a little bit for y'all, but that can be very problematic for people, and it can cause a strain because they quit listening to the person and they're focusing on their own distress. the person may not recognize it, or somebody may, like, if they have a sensitivity to hearing chewing sounds, they may get irritable at the meal table every single day or a lot of times. And other people don't understand why they're getting irritable. They may snap at people. Do you have to chew so loud? I know I feel like doing it sometimes, but I recognize that people are not chewing that loud. It's just I am hyper aware of the sound that they're making and the sound that I'm making. Tinnitus and hyperacusis are associated with concentrated communication. Imagine having a loud hum or a beeping going on in your head constantly while you're trying to focus on what somebody's saying. It makes it difficult. And people with tinnitus have to focus a lot harder on hearing and focusing on on conversations. People with hyperacusis, they need the sound so low, they may have to strain to hear. So it's a double-edged sword. They want to hear the conversation, but if the conversation is at an average sound level, it's painful to them. They may put cotton in their ears so it doesn't feel so loud, but then they have to strain harder to hear what's being said. Avoidance of sound-rich environments often limits opportunities for effective interpersonal support. People don't understand until you explain to them what's going on. So that's part of it. We need to empower our patients to explain to their friends and family, hey, I really want to hear what you have to say, and this is what's going on with me. That way they understand. They can be a little bit more compassionate once they get it to a certain extent. We need to help people identify strategies they can use in order to make diverse environments less overwhelming, less anxiety provoking. Earplugs can help. Noise-canceling headphones can help. There are a lot of things that you can brainstorm and think, what is it that needs to happen for you to be able to tolerate what's going on? Greater awareness of functional limitations is associated with increased distress, which may reinforce symptom focus. If they feel like, hey, I can't go to this restaurant, I can't go to this concert, I can't do this, I can't do that with other people because the sound is just overwhelming, or because of their tinnitus, they have difficulty focusing on doing work. It's just so loud. It's so overwhelming. It's like a bullhorn in their head all the time. It can feel very stifling. That's not even the right word. It's worse, way worse than stifling. And they start focusing on all the things they can't do, helping them acknowledge what they can't do. We don't want to invalidate their feelings or their thoughts, and helping them, looking at hardiness. What are all the things they're committed to? What things can they do? We know what they can't do. What things can they do? And then for the things they can't, are there ways we can help them modify it so they might be able to do it some? Social withdrawal and isolation are both linked to higher levels of depression, anxiety, and reduced quality of life. That adds stress, which often intensifies symptoms. Emotionally, anxiety is very present in people with these audiological difficulties. It's described as both a reaction to persistent auditory symptoms and a factor that amplifies distress and symptoms. Anticipatory anxiety, I touched on this earlier. Fear of noises. I don't want to go out because I'm afraid I'm going to hear that. I don't want to go to the movie because I'm afraid I'm going to hear that sound. People eating popcorn sometimes, or the sound of a straw going up and down in one of those plastic lids. I know some people that just drives them absolutely nuts. They may not want to go to those environments, which may make them feel like the world is becoming less open to them. and they become anxious before they have to go out into any of those places. Helping them develop a toolkit that can help them survive. If you start feeling overwhelmed, if the sounds get too much, what can you do? My go-to is always excuse yourself and go to the bathroom. Generally, the bathroom's pretty quiet. That works for a lot of different things. And people aren't going to follow you to the bathroom going, hey, let's keep talking or making noise or what have you. Tinnitus, hyperacusis, and misophonia are all associated with elevated generalized anxiety symptoms and greater functional impairment and distress, suggesting reciprocal interaction between anxiety and symptom burden. Generalized anxiety about a variety of things most days. I'm worried that I'm not going to be able to keep my job because I can't focus. I'm worried that my relationships I'm going to be abandoned because I can't tolerate being around certain sounds. I'm worried that, you get the point. You can see how the functional limitations of people with these audiological conditions can lead them to be anxious about a variety of things in their life. And most worry that the symptoms are going to get permanently worse. Helping them recognize what may or may not happen is also important. And that's a discussion they need to have with their audiologist. And it depends in part on what is causing or what some of the things are that are contributing to these symptoms. Misophonia is characterized by immediate and intense irritability in response to specific trigger sounds, helping people acknowledge, okay, I'm hearing it, and then develop down-regulation skills they can do right then. Breathing can be super helpful. Counting to 10, whatever it is that works for them. Anger can both result from repeated sound exposure and increased emotional awareness of triggers, reinforcing symptom severity. I have one aunt that has a laugh that's just, for some reason, there's something about it that grates on my nerves. I love her to death, but her laugh just grates on my nerves. And I know my voice, for some people, grates on their nerves. And so I'm not trying to throw stones. I'm just acknowledging there are certain sounds that can trigger distress, and then you become increasingly aware of those sounds when they happen, and increasingly attuned to it. So if she's laughing on the other side of the house, my brain goes, oh, there's that sound. Depression may both result from chronic tinnitus-related impairment, increased physiological distress, and reduced coping capacity, contributing to greater perceived severity. Increased physiological distress, going back to that sympathetic nervous system, sympathetic dominance, nervous system dysregulation, and systemic inflammation. All of those are going to contribute to some of the symptoms, including fatigue, brain fog, apathy. Distress, and especially grief-related distress, is often associated with loss of quality of life, functional abilities, role participation, consistent with disability-related adjustment. What is it that this issue is changing in your life or preventing you from doing? That is something that a lot of people have to grieve, their new normal, if you will. Individuals with tinnitus frequently report mental fatigue, reduced clarity, and subjective cognitive slowing. It takes them longer to get their thoughts together, particularly when distress is high. Well, when distress is high, regardless of the cause, people are going to have difficulty concentrating, subjective cognitive slowing, and it takes more effort to think. Why? Because their brain is not getting, their prefrontal cortex is not getting as much blood glucose to fuel it. All the fuel is being shunted over to the fight or flight response. Makes sense that it's harder Cognitive fatigue may both result from persistent sound-related stress and worsen perceived symptom burden. What can people do to reduce their cognitive fatigue? If they get cognitively fatigued trying to focus on writing a PowerPoint or typing a letter or whatever it is, okay, maybe they need to chunk it so they don't get as exhausted doing it. Recognizing that when they're doing it, they have this, their attention is split and they're fighting with their own nervous system to focus their attention on this, but then there's this other thing over here that keeps trying to pull their attention away. Tinnitus is associated with difficulty sustaining attention, especially in quiet or cognitively demanding situations. Remember, I said earlier, for a lot of us with tinnitus, when we're in the quiet, the sound feels overwhelming. It can feel piercing or almost deafening sometimes. In cognitively demanding situations, we have an increase in stress, we have an increase in cognitive demands on the brain, and it can be harder to focus attention because it's something that's taking a lot of energy and you just don't have any energy to give. Increased attentional focus on sound is linked to greater intrusiveness, reinforcing attentional capture by tinnitus or trigger sounds, helping people learn how to turn their attention to something else. For me, if I'm not anywhere where I can turn on background noise, I'll start humming. Humming doesn't bother me, but it drowns out the ringing in my ears. Cognitive load imposed by persistent auditory symptoms is associated with reduced cognitive efficiency, including concentration, task management, and executive functioning. Help people develop supportive tools. They can have push notifications. They need to write things down, have a calendar. Don't expect themselves to concentrate when they're sitting in a restaurant and there's all kinds of noise and stuff going on that already is trying to pull their concentration. Help them figure out what environment is most conducive to helping you concentrate. Persistent negative interpretations both emerge from chronic symptoms and contribute to their maintenance, consistent with the bidirectional nature of what we've been talking about. These negative interpretations, this is completely out of my control. This is the worst thing ever. I can't survive this. All of those distress intolerant thoughts, helping people develop distress tolerant thoughts, helping people recognize when they're having better days. The sound intensity or the intrusiveness of the sounds are not the same every single day, helping them identify what's different on the days that the sounds are not as intrusive. Environmentally, the ability to tolerate common noises, as we've talked about multiple times, hyperacusis leads to avoidance of many routine settings because people are just not wanting to subject themselves to pain. Go figure. What can they do? And I mentioned earlier, noise-canceling headphones. They have noise-canceling earbuds that you can put in now that don't have cords or anything on them, so nobody can see them. Those can be really helpful for people with hyperacusis because it takes it down about 10, depending on which ones you get, 10 to 20 decibels. Misophonic intolerance of specific environmental sounds, helping them identify what sounds trigger you and what can you do to address those issues. Helping them develop a plan is important. And again, helping them recognize, are there certain things that make those sounds, make you more easily triggered by those sounds? For example, being tired or being stressed or certain times a day. Tinnitus, as I mentioned earlier, may make it difficult to tolerate silence. Difficulty hearing or understanding conversations or television is another problem in the environment because we want to hear what's being said on TV. Obviously, one of the easiest things there, if you have to have the volume down enough that it's not hurting your ears, is having the subtitles on. Yes, you'll lose a little bit of something, but it's one of those compromises. We're not saying we can make the world perfect. We're saying what things can you do to mitigate the distress you're experiencing. Environmental limitations are associated with reduced participation in activities, increasing disability, and narrowing the individual's usable environment. In terms of cognitive behavioral therapy, we want to target tinnitus-related distress to reduce emotional, cognitive, and behavioral responses to symptoms. And obviously, it's dysfunctional behavioral responses to symptoms, like socially withdrawing. What else can you do? Can you put in earplugs? Can you have background noise on? What is it that you can do? Like for my fan, the low setting drives me absolutely bonkers. It hurts my ears. Medium setting, no problem at all. So are there adjustments you can make? Address maladaptive beliefs, negative appraisals, hypervigilance to sound, and avoidance behaviors. These can be accomplished with cognitive restructuring, behavioral experiments, for some exposure therapy. They can sit in an environment where they're hearing people chew, learn how to downregulate. That way they can tolerate it if eating with family is part of their rich and meaningful life. Attention to redirection strategies. That's also important. What can you do to turn your attention so you're not focusing on the ringing, the beeping, the crinkling? Reducing cognitive load and supporting attention and task management. Writing it down, schedules, push notifications. Anything to reduce the amount of energy your brain has to use on things other than existing. Sleep and circadian rhythm improvement. Encouraging people to adjust the timing of their interactions because the conditions for some people are impacted by time of day. Stress reduction is a common treatment target due to the association between tinnitus, misophonia, and autonomic nervous system activation. Really having them engage in some of those activities we've talked about in other videos that strengthen vagal tone so they can downregulate their nervous system more actively. And patient education to reduce fear, catastrophic interpretations, and maladaptive coping behaviors. What is going on? What's the reality of your condition? How common is your condition? Because a lot of people feel like they're weird, like nobody else has this. No, it's really pretty darn common. And what can they expect? And accurate information about symptom mechanisms and prognosis also is associated with improved coping and reduced distress. You may have to help them advocate with their audiologist or their doctor to really get informed about these things, but it can help them recognize that, okay, I know what's going on, and in most cases, it's not going to get worse. There are a few causes it may get worse over time, but at least they are more aware of what's going on. Sound enrichment, reducing silence, managing exposure to trigger sounds are all commonly used to reduce distress. Although excessive avoidance, and this is important, excessive avoidance may increase sensitivity and distress over time. We don't want people to withdraw completely, but having a safe place they can go that's quiet, where they can downregulate, is really essential in order to help them feel empowered to go into the environment, and especially one that's not controlled by them. In terms of apps, the American Tinnitus Association has a whole list of apps. My Noise offers over 300 customizable soundscapes. Resound Relief, Relax Melodies, podcasts, and music streaming are all recommended by the ATA for interventions for people who have tinnitus. Tinnitus, misophonia, hyperacusis are very common conditions and increase in prevalence as we age, unfortunately. Since these issues are often invisible, most people suffer in silence, not realizing what they are experiencing is a real condition and very common. Eliminating unnecessary distress and enhancing efficacy in managing unavoidable distress improves people's quality of life and is associated with an increase in perceived quality of life and disability management. Are there any questions? Alrighty, everybody. Like I said, as soon as we get our internet back, I will edit this and get it uploaded so you can watch a much higher quality recording. But I appreciate everybody for being here, and I will see you next week, hopefully with full bandwidth internet.